Well, welcome, Mark, to A Better
Thanks.
Health Together.
Thanks,
And
Learne. Good to be here.
yeah, and Mark, like myself, is working remotely, as we have done for many weeks. We'd like to share with you, I guess, just really what we've done during this period around COVID, but importantly also just open up that dialogue about how we transition the organisation to new ways of working. And while we were incredibly busy with general practice, it's interesting to hear, Mark, your perspective of the work during that time for the NGOs.
Yeah, there were a number of things they really were looking for from us, and that was confidence that we were going to continue to meet our contractual obligations to them. And I think that was one of the things that we did very early on to ensure that they had absolute confidence that we were going to be there with them, working alongside them. I think the other thing for us then was about how do we support organisations to mobilise their workforce, and what we're able to do there is ensure that they had the right resources and funding to be able to support their staff to become mobile. And I think the third thing really was important was just sharing information in terms of the learnings across our commissioned service providers, but also what the things that we were hearing and understanding from across Australia through our other primary health networks.
And a little bit like general practice on one hand. So one of the things we did with general practice, which were key, was set up a health pathway, particularly around COVID, which was an integrated pathway, and that was well accessed by the clinical community. I mean, like many organisations, we grappled with how do we move straight to remote working, and we established not only an emergency response team but a plan ahead team, which was really dealing with issues on the ground as they arose and how we functioned. I think one of the big takeaways for us was that virtual environment and how we need to really leverage that in a proper way, not in an improper way, but where it's right and proper. But NGOs also did some of that, didn't they? They moved to a virtual environment and tried to balance out what was face-to-face with what was virtual.
Absolutely, yeah. Look, I think that was one of the things that that was most heartening in many respects in terms of the way that providers absolutely embraced whilst this was hugely challenging. I think for so many they saw it as being an opportunity. And I think we know, for having been clinicians ourselves, we're often the people that put up those barriers in terms of introducing technology or new ways of being able to interact with clients and patients. And I think this provided an opportunity because everybody had to do something, everybody had to change, and everybody had to adapt, and telehealth became a very important platform.
Yeah, I think that's right. And for us as an organisation, we're working through what's our shape into the future. We learned a lot about how to support staff to work virtually and remotely. We're cautious about our staff, for example, visiting general practice. We wouldn't want to, be in a space where either the practice or our staff could be at risk. But conversely, this movement to a mixed model that works with our stakeholders effectively but enables us to develop, given the learnings. And I think one of the key learnings, I'd be interested in your comment, Mark, was just trust that our staff were incredibly productive, all hands on the deck. They all worked across the normal silos. There were great benefits that we garnered in an unintended way that our staff really, took it up a notch.
Yeah, absolutely. I think, and I know from the conversations we've had and across the exec team and the organisation, I think it's one of the things that we're probably most proud of in terms of the way that our people, everyone that works within WAFA, acted so quickly and decisively in terms of moving to that remote environment, and the way that they have been able to adapt work, as you said, across the organisation, and still be able to provide so many of the business as usual processes across our organisation, but externally with our stakeholders, and providing great support to them as well. Yeah, it's been fantastic.
Yeah, so I think going forward, the challenge for us is to look at the design of the roles that people have, because like most organisations, they weren't designed for a mixed model of some remote, some in-house, something else. So there is a design piece, but again, I think that'll be slow and steady.
That's right. Yeah, and I think that's probably been a real marker in terms of the way, as an organisation, we've gone about it. It is being slow and steady, yes, to a degree, but it's being really planned and thinking through it. We've got our staff and stakeholders at the forefront of our minds in terms of who we're trying to both support, but also ensure that we keep safe.
But thank you, Mark. Thank you for your time, and look forward to talking again soon. And bye for now.
We will. Thanks. Bye.